Interpreting pathology reports, what to look for in colon health. When you receive a pathology report after a colon biopsy or surgery, it might seem overwhelming at first. But understanding what the report says is key to knowing your diagnosis and planning your care. Let's walk through the main parts of a colon pathology report so you can grasp the important details. First, the report starts with demographic and specimen information. This includes your name, birth date, and details about the procedure performed. It also notes the exact location in your colon where the tissue was taken. This helps your doctor understand the context of the findings. Next is the gross description. This part describes what the tissue looked like to the naked eye. It covers size, weight, color, and texture. For example, the report might say a polyp measured to centimeters and was tan in color. This initial look helps guide the microscopic examination. The microscopic description follows. Here, the pathologist examines the tissue under a microscope. They look at the cellular makeup, identifying abnormal cells or structures. This detailed analysis is crucial for diagnosing conditions like inflammation, polyps, or cancer. If cancer is present, the report specifies the tumor cell type. The most common type in colon cancer is adenocarcinoma, which originates from the glandular cells lining the colon. Knowing the cell type helps determine the behavior of the tumor. The report then discusses the histologic or tumor grade. This indicates how much the cancer cells differ from normal cells. Well-differentiated tumors look more like normal tissue and tend to grow slowly. Poorly differentiated tumors look very abnormal and often grow and spread faster. The grade provides insight into how aggressive the cancer might be and influences treatment choices. Tumor staging is another vital part. It describes how deeply the tumor has invaded the colon and whether it has spread to nearby tissues. For example, a T for tumor has invaded nearby organs. This information helps determine the stage of the cancer, which guides treatment planning. Lymph node involvement is also reported. The pathologist notes how many lymph nodes were examined and how many contain cancer cells. The presence of cancer in lymph nodes often indicates a higher stage and can affect prognosis and treatment decisions. Margins are the edges of the removed tissue. The report checks if cancer cells are present at or near the margins. Clear margins mean the tumor was likely completely removed, while involved margins may suggest residual disease remains. Another important factor is lymphovascular or angiolymphatic invasion. This means cancer cells have entered blood vessels or lymphatic vessels, increasing the risk that the cancer could spread beyond the colon. Detecting this invasion can influence recommendations for additional treatment. Some reports include molecular or genetic findings. These might show specific mutations or protein markers that can impact prognosis and help tailor targeted therapies. However, not all reports contain this information. Understanding these components helps your healthcare team assess the severity of your colon condition, decide on the best treatment plan, and estimate your outlook. Remember, each person's situation is unique. Always discuss your pathology report with your healthcare provider, who can explain what the findings mean for you and guide your next steps. By knowing what to look for in your pathology report, you become an active participant in your health journey, ensuring you get the most accurate and personalized care possible.